Hi, I'm Walt Medlin, BonusLife.com. I'm a bariatric surgeon and a bariatric surgical patient at the Bariatric Medicine Institute in Salt Lake City, Utah. BonusLife.com is my personal educational website, and I just wanted to talk today about the subject of mobility. It's a very interesting thing because when we talk about obesity in America and overweight, a lot of times the discussion quite easily goes towards early death or cancer, heart disease, diabetes. But this is actually the thing that most people are the most excited about after surgery. They can move again. And even if they're psyched that their diabetes is under control or their blood pressure, like me, my blood pressure was my big issue that took me to surgery. The joy that I have and my quality of life, again, we always talk about being a butt-kicking 80-year-old. I might as well own it. That's what makes me wake up happy in the morning, is to know that I'm going to be able to move, and also know that I'm not going to be starving all day like I was when I was on diets. I could get my weight down, but I couldn't keep it there. And now I don't have that hunger. But my joy is getting outdoors, and I got outdoors even when I was heavy, but it's a lot easier to move, and I can go better and just have more fun, and I don't worry as much about issues. So specifically though, my older patients have a lot of times really bad back. Now, we're not going to improve your back itself in terms of your discs or your bone spurs or surgeries that you've had. That is going to be your back. But if you have less weight on it and you are better able to tolerate movement, exercise, and core strengthening, then that's going to improve the function of your back. We're not going to actually grow cartilage or anything, but most patients with bad backs notice a great deal of improvements. And I've had some people who were literally almost suicidal with their back pain, and this was able to get them, back moving in their life, and often out of a wheelchair or a scooter. The same thing goes for hip, knee, and foot pain. Plantar fasciitis is not one of those things that shows up again a big. A lot of people feel like it's a underappreciated disease, but there are a lot of people with crippling foot pain. And certainly, if you've had a hip or a knee replacement, you've actually had a higher risk operation than having a bariatric weight loss operation. These have about a 1% mortality rate or close to that, whereas bariatric surgery is less than a third of that rate. And then I like to talk about balance, because I think as we get older, a lot of people are just afraid to move because they're afraid of the fall. We're not going to change your balance, but again, some of balance problems can come from deconditioning and being less strong. And frailty, again, frailty is the number one enemy of the 80-year-old. You want to be sturdy, you want to be able to move. And if we're going to get you there, definitely having strength, having functional joints, being able to move keeps you moving. So I think that's my main start here. I should also just point out, since I'm yakking a little bit, when you feel better after surgery, a lot of people go out and do things they haven't done for a few years. Guilty here. Wear your helmet. If you get on a mountain bike and you haven't been on one in 10 years, you are not 28 years old anymore, and you don't have the reaction time, and you don't have the center of gravity retraining. You're actually kind of awkward, aged, and reverse. So be careful after surgery when you do lose weight not to go overdo it. You really, the adult athlete needs to train much slower to target, and you still need to be careful. And I can show you pictures of some black guys and some missing teeth, but not that many. All right. Thank you very much for your attention. I'm Walt Medlin, BonusLife.com. I hope this is helpful. Thank you very much.